This week again was a week that a virus that most people really hadn't heard of prior to the last 2 weeks dominated global headlines, triggered biocontainment units being opened on multiple continents, and exposed in real time the strengths and vulnerabilities of the infectious disease response system and infrastructure that we have in the United States and the world. The case count actually of hantavirus went down and then back up during this last week, but the lessons that surfaced about preparedness, the way the media covers infectious disease, the erosion of our institutions that deal with public health, and the ever present shadow of avian influenza, which is the preeminent pandemic threat, are worth more than just this outbreak itself. I think it really is putting a lens on things. So, even though the week was about hantavirus and also Ebola, which I'll get to, it's really about readiness and whether we still, as a species, have it. The hantavirus cruise ship outbreak continues to be the main public health story in the United States. It's probably not the biggest one. I'll get to what I think is probably a more important story now. It started the week at 10 to 11 cases, then went down to 10 after Dr. Kornfeld was removed from the case count. That was the physician who took over for the ship's doctor. He had kind of tested equivocally negative, positive, negative on PCR testing, but his antibody test was negative, and he had a flu like illness that probably wasn't hantavirus. And he's now been returned to regular quarantine out of the biocontainment unit. But in the last day or so, Canada has reported a case. This is someone, there was four Canadians on board that are being housed on Victoria Island. One of them tested positive. Again, remember, we expect to see more cases from that group of individuals that were evacuated off the ship. We know that there was a lot of contact, that there was a lot of exposure, and there are going to be more cases, so we shouldn't be surprised. In the United States, 41 people are being monitored. We've seen no secondary cases in the United States or anywhere in the world. And what I mean by secondary cases are cases of individuals who were never on that boat. All of the cases that we have, the 11 cases, including the Canadian case, all were individuals who were on the boat. None of the secondary cases, no secondary cases have heard. None of the individuals who had contact after people left the ship with the passengers that disembarked early have tested positive. One of the, I think, great stories here is the Nebraska Biocontainment Unit and the National Quarantine Center, which have really stepped up to be able to absorb these Americans that are there. And I think it really speaks to the investments in preparedness, not just with the Biocontainment Unit and the National Quarantine, but even Nebraska's innovative approach to developing a laboratory developed test that's specific for the Andes version of hantavirus. There is no commercially available test for that. We've got some antibody tests, which may have some utility in figuring out prior infections. The CDC has a research test, and there's kind of generic hantavirus PCR tests. But Nebraska developed a test, and I think this speaks to the importance of that regulatory pathway of laboratory developed tests, which got shut down during COVID, but how essential it is in a public health emergency. The ship, the Hondius, has made its way to the Netherlands, where it's going to undergo disinfection. Remember, this is not a very hardy virus. They'll be able to disinfect this ship pretty easily, although there's probably going to be stigma to being on that ship. The key debate of this week was really transmission nuances. What are the role of super spreaders? Was the index patient, the bird watcher, was he a super spreader? And is that what's responsible for the trajectory of this outbreak? And I think that harkens back to the Argentinian outbreak of 34 individuals that was really driven by super spreaders. Is this something that spreads very inefficiently in the absence of super spreaders? I think that's probably the case, but we have not seen secondary cases. As I've seen, there was a Delaware case in 2018 with no secondary spread. So I think that still needs to be worked out. On the ship, it seems obviously we have, first generation cases from the index patient, and there may have been some second generation cases as well, meaning individuals that the index patient, the bird watcher, infected, then went on to infect other people. I think we need to understand all of that contact landscape there. And remember, the widow of the first patient who herself died later was comforted and ate meals and hugs and with lots of people on that ship after her husband died. Understandably, nobody knew this was hantavirus, and that will be interesting to see what role that may have had. There really has been a media feeding frenzy. I've said in the past that the media really can only cover infectious disease now through a COVID lens. They did this with Mpox. They're doing it again with hantavirus. It's two speeds. Either they ignore something or it's 100,000 miles per hour. And interestingly, Jon Stewart from The Daily Show, the comedian, put a clip together of all of the different experts, including myself, talking about what this threat actually means and what it translates to the average person, and kind of the incongruity with what the media anchors might have been saying. It was funny. He did this during Ebola back in 2014 with one of my clips as well. But I think it speaks to the fact that this is a noticeable way that the media has now decided to cover infectious disease. Some very big names in infectious disease weighed in this week. Notably, Mike Osterholm said that he expected the outbreak to peter out in 10 to 14 days. I think he is someone who is really known for being able to have a good sense of outbreaks. He's very well experienced. He's written great books and a major kind of icon in the field, and someone I call a friend. And I think his analysis of this is pretty spot on. The other thing was Tom Frieden, who was the former CDC director and New York City Department of Health director. He basically said something that, when you're thinking about a cruise ship, there are different dynamics there that apply in the regular world, and you can't necessarily extrapolate them. And I think that's true. And the contact patterns, the ventilation, the shared bathrooms and the common spaces, all of that may play a role in how this transmitted. I think that's going to be really interesting to understand, is how this got around on the ship and infected those 11 individuals. The presumed source is still Argentina. Argentina has sent teams there trying to look at where that landfill was, what rats were there, were there pygmy rats there, was the initial patient's exposure there. There is some finger pointing going on, which you would expect between Chile, Uruguay, and Argentina, places where that couple visited before they got on board the ship. That always happens during outbreaks. I think it's important to know that there are certain provinces in Argentina where this virus is not present. So I think this may change the epidemiology in Argentina if that's indeed where they got it. Conspiracy theories are, I don't even call them theories because that gives them too much importance. This conspiratorial non-thinking is everywhere. And I read somewhere that it's like a Mad Lib's playbook. They just basically swap out COVID and put in Hantavirus, or put in whatever else they want to put in, because they're already primed and ready to go. I get messages all day on all my social media accounts. Some of them saying I'm an actor, some of them saying that I'm not a real doctor, some of them saying that this is all a hoax or a psyop, all of this kind of insanity, which is how infectious disease outbreaks are going to go for the foreseeable future, because of the way that people have basically jettisoned the scientific method, rational thought, logic, and the like. I wanted now to move to Ebola. So there is an Ebola outbreak in the Democratic Republic of the Congo. And this isn't unusual in and of itself. The Democratic Republic of the Congo has probably had at least a dozen or more outbreaks, and they usually know how to handle them. But this was announced on around May 15th with 246 cases and 65 deaths. So I think 246 cases being noted on the first notification, that is a really massive red flag. Why? Because it tells you that this has been spreading for some time before it was noticed. This is in a remote province, a gold mining province that may be hard to get to. Remember, the DRC is characterized by strife and conflict and violence and anarchy. So this is going to be very logistically challenging. But the fact that it was notified late, or that they recognized it late, means that there's probably multiple chains of transmission going on in that area, which is going to be harder to contain. Complicating this factor is that it is the Bundibugyo strain of Ebola. There are multiple different strains of Ebola. We only have countermeasures against the Ebola Zaire strain. And by countermeasures, I mean vaccines and monoclonal antibodies for treatment. There are no specific treatments for the Ebola Bundibugyo strain. So that's going to also mean that we have to go back to kind of the older ways of handling this, which is contact tracing, finding cases, isolating them, personal protective equipment, safe burial practices, public health communication. That's all going to have to happen, because we're not going to have a vaccine here to be able to protect the population from infected individuals. There has been international transmission of this. There have been individuals in Uganda, in Kampala, the capital, that have been diagnosed. 2 cases, to my knowledge, have been diagnosed with Ebola. Both of them were unrelated to each other, which tells you multiple chains of transmission. There was also a case in the DRC's capital, Kinshasa, where someone had come from the infected zone. All of this has caused the WHO Director General to declare a public health emergency of international concern. This is a designation that will really bring resources, bring the world spotlight onto this outbreak to try and contain it before it gets bigger. It was unusual that he didn't convene an emergency committee, but I think it makes sense given the late notification of this outbreak and the fact that we already have spread across international borders and of all the logistical challenges of dealing with an outbreak in this part of the DRC. Plus, this is the Bundibugyo strain for which there are no countermeasures. And I think that the WHO, Africa CDC, and other organizations should be able to contain this once they get the resources. And it's going to take some time to contain it because, as I said, multiple chains of transmission. It's been going on for some time. And there was an interesting op ed in Stat by Krutika Kapali, an infectious disease doctor in Dallas, who talked about the fact that this Ebola outbreak, as well as the hantavirus outbreak, really make the case for sustained, quote unquote, peacetime preparedness, meaning not only during an emergency, not only when something is in the headlines, that this needs to be something that is done sustainably over time. And many of us have argued for that all the time because this reactive scrambling is not a sustainable or a good way to do this. A couple of other stories. Avian influenza. I think this is really the threat behind every headline. This is something that I think will cause a pandemic. Remember, 1918 was an avian influenza pandemic. Right now in the United States, we have Indiana, Minnesota reporting active poultry outbreaks. Indiana seems to be particularly hard hit. My question is, how many humans that work in those poultry farms are getting tested? I just like to know the number. How many tests did you do? I don't know if it's zero. I don't know if it's a lot. We know that there's probably not any positives, but are they actually looking? Or is this kind of see no evil, hear no evil? Interestingly, WHO's Maria Van Kerkhove, who's an American that works at the WHO and who was very competent, and I always enjoy watching her speak. And I interestingly was on a podcast with her, not at the same time, but we were both on the same podcast called Naked Scientists, talking about hantavirus. She said that when she first heard about the outbreak on the ship of hantavirus, she was worried that it was avian influenza. And I think that's exactly how you'd want to be. That is the biggest threat that our species faces right now. And the fact that it wasn't, everybody breathes a sigh of relief. But think about avian influenza. 94% of backyard flock owners in a study can't recognize avian flu symptoms in their animals. That's in the United States. And I live in the city of Pittsburgh, and there are backyard flocks in the city of Pittsburgh. There are backyard flocks all over the country, and people are handling those chickens. And it's not that the chickens have avian flu inherently; it's that they mix with wild birds or waterfowl that come around, and maybe a goose poops and they get and the chicken gets infected. If you don't know the symptoms, you're not going to know that it's dangerous to handle them. So that's these backyard flocks are something I think is important to keep in mind as a part of the threat matrix here. There was an H5N6 death in China. It's the 93rd H5N6 case in China. This person was slaughtering a dead poultry. Remember, when I say avian influenza, there's a whole swarm of them. H5N1 is the one that we talk about in the United States, but there are others that are equally scary or even more scary, like H7N9 and H5N6, which killed someone in China in its 93rd case. I think that the overarching theme of avian influenza is we are flying blind with these viruses. And it is the biggest pandemic threat, and it's grossly underappreciated. Lastly, I wanted to mention measles. It continues its march towards endemicity in the United States, around 1,900 cases, 27 outbreaks, and we're not even halfway through the year. We're on pace to exceed 2025's number of outbreaks, and I think this is exactly what you would expect an endemic virus to do. The South Carolina outbreak seems to be resolved, but Utah seems to be the main epicenter now that we're trying to control. But it's not, it's everywhere. So the Metropolitan Opera in New York City, this, very storied venue where people are dressed to the nines, watching really elegant art. There was a measles exposure there. And ironically, it was during a performance of Le Boheme. Le Boheme is a opera about tuberculosis. So it goes with the infectious disease theme. Arizona is another state to watch. 95 cases. Maricopa County is one of the major focuses. And remember, Arizona also borders Utah. I think that the issue at schools continues to be in the headlines. At schools, are they going to publicly post their vaccination rates? I know they're on the health department's websites, but are they really advertised? Do people understand that this neighborhood school that they are sending their children to, that they are supporting with their taxes, is basically a pest house? I think that continues to be one of the problems, that these school administrators, including school superintendents, are basically leaving the school nurses in a lurch, not empowering them, and creating pest houses there. And I think the US will lose its elimination status in November. I think that's a foregone conclusion. And I think this we have to lay at the hands of the anti vaccine movement, full stop. That's why this is happening. So, to sum up this week, I think hantavirus reminded us that when we have infrastructure like the biocontainment units, like the ability to make laboratory developed tests, that it really works. But it has to be something that's maintained. It has to be something that's valued. It has to be something that is sustainably going to be um, supported, and that's not always the case. The key question is, are we going to be able to fix this? Are we going to be able to protect all this infrastructure domestically and globally before there's a bigger threat like avian influenza? And I think the Ebola outbreak in the DRC, the hantavirus outbreak, measles, all of these are things that people should kind of integrate together and say, are we, the United States, are we, the world, resilient to infectious disease threats? We have the science and technology to master these issues, but do we have the will to actually implement them?